Hi there, this is Diagnosis Bona Kratza Bona, and it's my fourth video, and today we will talk about esophagus. So today we will talk about gastroesophageal reflux disease, esophageal perforation, diverticulum cancer, and also about achalasia. So let's get started. Gastroesophageal reflux disease. It's when stomach acid from the stomach leaks up into the esophagus, and it's a common physiological event in newborn infants, and most cases clear up completely when the baby starts sitting, and in adults it can lead to many complications like esophagitis, esophageal ulcer or structure, also iron deficiency anemia, and also to a premalignant condition known as Barrett's esophagus. Symptoms are nausea, bloating and belching, heartburn, acid regurgitation, especially lying down at night, and diagnosis is usually made on history, and treatment will be achieve normal weight if overweight, avoid large meals and overeating, antacids or alginate compounds, and if it persistent can be used H receptor blockers or proton pump inhibitors like omeprazole. Esophageal perforation. Because the esophagus lacks a serosal layer, it's more vulnerable to rupture or perforation. And once a perforation occurs, retained gastric content, saliva, and other substances may enter the mediastinum, resulting in mediastinitis. And in many cases, it happens due to medical instrumentation for diagnostic and therapeutic endeavors. In other cases, it could be after vomiting, post-traumatic, or after trauma. And symptoms are pain in the neck, chest, dysphagia, idomophagia, dysphonia and dyspnea. And when perforation is suspected, contrast esophagography should promptly be performed to confirm this diagnosis. And so treatment, it could be surgery or conservative using parenteral nutritional support, broad spectrum antibiotics, and also narcotic analgesics and nasogastric suction. Esophageal diverticulum. It's a protruding pouch in the lining of the esophagus due to motility disorder of the esophagus. And in many cases it's asymptomatic, and but also could be dysphagia, pulmonary aspiration, aspiration pneumonia, cough, also halitosis, bad smell from the mouth, and gargling sound in the neck. So, and barium radiography is a diagnostic procedure of choice. Treatment, it could be diverticulectomy, or if it's asymptomatic or minimal asymptomatic, esophageal diverticula do not require treatment. So cancer, it's a malignant tumor found in the tissue of the esophagus, and Typical symptoms are fatigue, progressive dysphagia, weight loss, and also could be hiccups, could be an early symptom, early sign, and dysphagia could be at beginning of meal. Also, it could be pain or discomfort, and so diagnosis it's endoscopic with biopsy, and treatment depends on the stage of the esophageal cancer. It could be just resection, endoscopic resection, or endoscopic resection with lymphadenectomy or with schema. Or in some severe cases, it will be just palliative therapy. Okay, and the last one is achalasia. It's a rare esophageal motility disorder characterized by impaired relaxation of the lower esophageal sphincter. And the main symptoms is progressive dysphagia to solids and liquids. Also, it could be night regurgitation of food, cough, pulmonary aspiration, weight loss, and diagnosis confirmed by barium swallowing or manometry. And treatment is pneumatic dilatation of lower esophageal sphincter or surgical myotomy, and conservative in the elderly. So that's all. Thank you very much for watching me, and see you in the next video.